This is OHSU, shaped by leaders, pioneers, and those brave enough to take that first step. We carry the torch and shine a light on what is possible. We are a collaboration of disciplines, listening to one another, learning from each other. The OHSU Family Nurse Practitioner Program, Doctor of Nursing Practice, is more than an opportunity to gain experience. It's your time to serve with a community of trailblazers and groundbreakers.
As a family nurse practitioner myself, I am passionate about giving patients the skills to be able to change their outcomes. What is it that motivates our patients? What are the barriers? What are the environmental, social determinants? What are all the factors that go into having somebody be able to take care of themselves when they have an acute illness, a chronic illness? You have to really know the health from birth to death. That's a lot of population to work with. How do you diagnose acute and chronic illnesses? How do you work with that? How do you know which lab to order? How do you know what medications to order? So our family nurse practitioners get all that. They truly understand pharmacology management. They truly understand the science that goes behind taking care of our patients' illnesses. But they also know that it is critical to understand all the variables that our patients are living with on a daily basis.
Every time you interact with a patient, when they walk out of that room and they're happier, more confident, healthier than when they came, you know you're making a difference. I'm certain that I did make the right choice, but I don't know that there was necessarily an aha moment. I think probably having a job lined up here that I will start in the next couple weeks was like probably a boost, like, yeah, this is going to be good, you know. One of the great things about this distance piece of this program is that I'm actually doing clinicals around where I live. I've already had some of the clinical hours. The preceptors I've had have been people I've known previously, just because of where I'm at. Our instructors are pretty diligent about getting us the right people, and then not only that, but checking in to make sure that the right things are happening in our clinicals and we're getting the experiences we need and want.
There's so much responsibility that comes with being a nurse practitioner, and therefore I wanted to be in a program that had a certain level of rigor and kind of held me accountable. And I think it was maybe good for my family to see me working so hard towards something, and my son to see me working towards something. Making a difference in people's lives is even more evident in rural areas when it almost seems like you're treating an entire community.
I've always been rural. My experiences in the city it's a nice place to visit for a couple days, but I do not ever want to live in a bigger city. And then, my ties, I just feel stronger ties to rural Oregon. My whole family pretty much lives in Milton-Freewater. They farm here. I enjoy being able to kind of help with that when I can.
We look for students that are committed to their communities. That's critical for us. We look for applicants that have a real sense of what is happening in their communities. They've taken the time to understand what are the healthcare issues. So we look for nurses that see that being a nurse doesn't mean you just care for the patient that's in front of you, but you take the time to understand the family of that patient, the community they come from. So we look for those kinds of nurses that are thinking a little bit more globally.
For lack of a better term, it's like being a nurse on steroids. We get to do all of the things, but still leave our nurse hat on. Nurses have a very valuable position in the medical field where we are kind of trained to be with patients and to be a part of their journey. And so a nurse practitioner allows us to enter that provider role still with the makeup of a nurse.
When they graduate, they feel that they absolutely have the skills to start working. So they are practice ready, but they also have the skills to be able to really figure out how to do those quality improvement projects, how to do the research that will help them absolutely determine if the programs that they have initiated or existing programs, are they working? Are they effective?
I really do feel like I'm making a difference. I feel like I have a chance to offer, in places that just don't have enough providers. And so getting to fulfill that role and somewhere that's close to home and somewhere I've grown up is pretty special for me.
If you really want to be the best nurse practitioner that you can be, then this is definitely a program that you should consider. And you may have to make some sacrifices because there is, more face-to-face interaction and a little bit of travel. OHSU has connections all over the place, and I think because they have these connections, they can really provide you with maybe a little bit more of a robust experience.
At some point, it's about the why you do what you do, as much as the how. We do it because we are bold. We do it because someone needs to make the difference, and we know we can make the difference because we already have. We welcome the curious, inspired, and those willing to be bold. This is OHSU.